Hey guys, gals, hope you're having a beautiful day. I have some great information to share with you today. It's all about your lower back, lumbar radiculopathy. Let me see if I can pull myself up here so we can see each other. There I am. Hey guys, nice day, beautiful day out here. I'll tell you in sunny Florida. I hope you're having a beautiful day as well. Let's go into a couple very important things. We look at this picture right here, the old irritated lower back nerve. Wow. The old pinched nerve, irritated nerve that stems from the lower back and makes up the sciatic nerve down towards the back of the buttocks and legs and feet. Now you realize this nerve being affected is at the L4S1, I'm sorry, the L4L5 area, L4L5. And we're going to talk about the difference on how and where these nerves are irritated and what they affect and how you can determine where the nerve is stemming from, exactly which nerve. Very important. So we're going to talk on dermatomes, myotomes, talk a little bit about, in English, what areas of the legs they control, what muscles do they affect, and you'll notice if you have weakness in certain muscles, then you pretty much can pinpoint it to what area is controlling it. Great anatomy, something, as well as neurology, something great I think that you all should understand. So if we get into a little bit about what's going on here, it gets a little complex, but as you can see, quite commonly, millions of people are going to have back pain, and because you have sciatic pain, it can come from different areas. We talk about anterior sciatic, which is really no such thing, but posterior sciatic is the true normal sciatica. So as we get more into this, you're going to start to really understand the difference and how the body works and how it functions. It's quite complex. Again, we've seen these conditions right here in MRIs. Many of you have had MRIs, could have bulging discs. This is a normal disc on the left side. You can see the normal discs, the nerve roots are normal, and then you can see that the L5S1 on the lower right, on the right side, that is a nice, excuse me, big herniation. That could obviously affect the nerve root and affect areas right down the back of the leg. Excuse me. So that is something I want you to understand, that if you're having symptoms in your leg, we need to know how to find out where it's stemming from. This is our job today. There's, again, desiccation, loss of water in the disc space, L3, L4, L4, L5. L5S1, nice herniated disc there, could be quite painful. Many people, again, have herniations and don't even know it. Here you go here, another view here. When you look at this view, let's see if we can get rid of that. We're looking L4, L5 disc. You can see the disc below is not near as affected as the one that's circled in pink there. The one on the right does show a different view. That's not important for you to understand, but I just want you to have a basis or an understanding. Now, many people with lower back pain have this condition. It's called Piriformis Syndrome. See that muscle called the piriformis? That sciatic nerve runs right underneath there. So if you got a wallet in your back pocket, you're sitting down a lot, this can cause that nerve to become inflamed and irritated. There are piriformis stretches you can check on my channel that are really good for lower back pain. A lot of those stretches can help this particular problem. This is commonly seen throughout the world. As we look here, we'll come back to that. I want to go to these charts now. If you look at the nerve root there, the L3 nerve root, and that comes up a little bit higher, obviously. You have the L3 nerve root that would generally affect around the groin area, and it goes into the front of the thigh. If you look at the L4 nerve root, it goes to the front of the thigh, down to the front of the leg in the tibial area. The L5 nerve root again affects behind and the outside of the thigh, and it goes down into the calf to the big toe. And what's important about L4 is L4, they do have different distributions, but I want people to understand that the L3 nerve root is generally going to affect the front of the thigh. So if you're getting problems within the front of the thigh, which we'll come back to this in just a second, that's not sciatica. Sciatica generally is L4, L5, S1, S2, S3, those 5 that form into that sacral, that lumbar nerve root. The S1 nerve root, you can see more posterior, back of the calf, behind the thigh, and you can see on the outside of that foot as well. That's that thick blackened line that represents a sharp radiating radicular pain with a dermatome pattern. The dotted lines indicate the location of the numbness or tingling sensations. So let me go ahead and show you this picture here. This is a little more precise. So let's say you're getting a burning, particularly on the little toe. Okay, you can see S1 on the bottom right. You can see the dermatomes, the areas of your legs, what nerves are being affected. And you can actually see, like in the anal area and the rectal area, how the sacral nerve roots come into play, even into the male parts there, the genital area, the L1, L2, you can see comes around, but the S2 would affect that region. So it becomes very complex, but this is a good chart to go back to. So if you're getting burning in a certain area in your leg, this will give you a thorough understanding where the nerve root is actually stemming from. Here again, we look at figure A, the clinical alteration of L4, L5, S1 injuries. We can see the areas that's shaded dark. And in the B, middle one, you can see the clinical alterations of the patients with an L5, S1 injury. Those are generally the dermatomes that will affect. And then you can see probable human L4 dermatomes, which is obviously different in C. Just kind of give you a little understanding. But this stuff does get quite complex. I just wanted to give you an understanding more what's happening, particularly if you're having lower back pain. Look here now, this area here, you see the L4, L5, that along with the first, the second, and third sacral nerve roots, which don't show it here, but that goes down the buttocks, down the back of the leg, does not affect the front of the thigh. So if you're getting tingling or numbness or burning in front of the thigh, look to the left here. You see the lateral femoral cutaneous nerve? Look at that nerve. It could be affected right in the inguinal ligament, being compressed there. People that sit a lot can be getting these problems in the front part of your thigh area, into the groin area, coming from that area, just from compression, not even from the disc, but just peripheral where it's coming out of. And last but not least, I want to just go review this with you to give you an understanding about the nerve roots here, how L1, L2, what it affects. We talk about the hip flexors. The hip flexors are primary L1 to L3. Iliopsoas, those are the hip flexors affecting mainly in the inguinal area, the anterior superior thigh area, up in the top front of the thigh, not the back. The L3, L4 affects the quadriceps. In other words, when you extend your knee, the quads are affected from there. The L4, L5, tibialis anterior, front of the leg, down below the knee. L5S1, the extensor hallucis longus, that's our big toe. And again, you can see the reflexes there, L3, L4, which is your patellar reflexes, your S1, S2 are your Achilles reflexes. You could also see, again, the dermatomes. You can read this on your own, how it affects what area, the inguinal, L1, L2. You can see sometimes people complain of like right on the front, on top of the kneecap, L4, L5 common. And then, particularly some people have weakness in the hamstrings or burning. But this is a great little thing for you to have at home. I just wanted to share this with you. This is really great information. And I think it's something important that can really give you a better understanding. And this is what this quick little video was put together, because I got a lot of people asking me, what about this nerve? What about that nerve? I ask you guys to subscribe to my channel, use my videos, share them in your social media. This is very important information. Try to keep it simple with you. I know it's a little complex, but it really isn't, because it kind of gives you an understanding what area it is. That's what it's all about. So there really is no such thing as anterior sciatica. Sciatica is generally behind the thigh. Front of the thigh generally is not sciatic, but the outside of the thigh and behind the thigh, underneath the buttocks and going below the knee, is all the sciatic nerve root. Leave your questions for me. People always asking me how to get a hold of me and potentially chat. I go to my Facebook at Motivational Doc more commonly. I understand. I try to answer how many questions as I can, although I get many emails. I just want to say blessings to all my listeners out there. May God bless you, and have a beautiful day, night, wherever you are worldwide, and a fantastic week or a impeccable weekend. Ciao now.